My name is Ben, and in this video I'm going to be performing 4 manual techniques for a shoulder separation / sprain. So the first technique that I'm going to be performing is a 50-50 MFR of the pec major specifically, and one important thing to keep in mind that I'm going to be doing is trying to improve flexion and abduction of the shoulder, and so just keep that in mind when looking at these techniques. So to perform the MFR of the pec, we're going to get our patient lying supine on the table. For the sake of this technique, I'm just going to assume, the next few techniques, I'm just going to assume that it's the left shoulder that's affected. So to target specifically what I want to do, I'm going to start and find the origin of the pec major, which is going to lie close to the sternum here. So I'm going to place my right hand right here along the sternum in line with the lower fibers of the pec major, just because it's more targeted to help that flexion and abduction. And then I'm going to place my other hand up here along near the insertion of the pec major. Now to perform the actual technique, I'm going to allow my hands to sink in, try to keep them relaxed, and just allow them to sink in until I locate the first barrier known as the depth barrier. So I'm just going to allow that to happen. And then once that's done, I'm going to separate my hands apart from each other in this direction and locate the longitudinal barrier. So I'm just going to do it until I feel like my hands are blocked, and I'm going to sit here and allow that to release. This can take up to 5 minutes, but it should release, and during this time I should feel like my hands will naturally want to go in towards one specific direction in what's called the rotational barrier. So as you can see from what I'm doing right now. So when I actually perform this technique, I'm allowing my hands to sink in for the depth barrier. Let's say it releases, then I'm going to go into the longitudinal barrier, and let's say it's bringing me into this position for the rotational barrier, and then I'm going to allow that to release. Now what I'm going to feel is I'm going to feel at each point, like for example when I go to the depth barrier, I'm going to feel a nice kind of relaxing feeling underneath my hands, like the tissue sinking in downwards. And then for the longitudinal barrier, it's going to feel like my hands are kind of sliding away from each other slowly. And then the rotational barrier is just going to feel like they're kind of guiding me towards one specific direction in rotation. And when I release this, I'm just going to release by bringing my hands out of that rotational barrier, so just like so, out of that longitudinal barrier, just like that, and I can just slowly bring them up. And that's how you perform an MFR for the pec major. The next manual therapy technique is going to be an STR of the pec major. So to perform this technique, we're going to get our patient lying on their back, lying in supine position. Then what I'm going to do is I'm going to grab my right hand, and I'm going to grab my left hand and bring the arm to a different position and feel kind of where the tension is just to start. So I feel like there's more tension up here, and assuming this position is okay with him for an AC sprain / separation. So what I'm going to do next is I'm going to get into a comfortable position where my arm and body is kind of locked, his arm in here. And I'm going to start proximal around the origin of the pec major. I'm going to use my open palm just because this is an easier position for me. I'm going to kind of do a J scoop into his pec major, locking down the muscle, and then I'm going to bring him further in this range of motion. Then I'm going to bring him further, I'm going to come back and release. I'm going to go now I'm going to work my way more distal. So I'm going to go here, down, work my way towards the insertion of the muscle. Again, every single time I'm doing the J scoop, and I'm holding that J scoop as I bring it into the full range of motion. Once I get back up, then I release. So this technique can be performed for 6 to 8 times total. And yeah. The third technique that we're going to be doing is a acromioclavicular joint MET, so specifically for restricted abduction. So to perform this technique, what we're going to do is have our patient seated. So we're going to have our patient seated in this position like so. And what we're going to do from this position is I'm going to first, before I get him to bring his arm up, I'm going to locate the lateral aspect of the clavicle. So I'll start here and I'll walk my way over until I find the lateral aspect of the clavicle just around where the AC joint is. So find the lateral aspect of the clavicle. I'm just going to hold in that position so I can feel the movement during when we actually perform this technique. Now what I'm going to get him to do is I'm going to bring him into 30 degrees of abduction and 30 degrees of horizontal adduction. So this is basically around where like scaption is. Okay, so now from here what I'm going to get him to do is resist against me for 3 to 5 seconds. So 1, 2, 3, 4, 5, and relax. I'm going to allow him to relax for a few seconds, and then I'm going to relocate a new barrier. Now underneath my finger right now, what I feel is kind of the clavicle going towards kind of like a posterior and inferior direction. And so now that we've relocated the new barrier, we're going to do it one more time. So push against me. 1, 2, 3, 4, 5, relax. And we're going to allow his tissue to relax, and we're going to bring him further. And we'll do one more. Go ahead. 1, 2, 3, 4, 5, and relax. And we'll bring him further. Perfect. So since this is an MET, what we want to do afterwards is obviously check if the range of motion has improved in this case, and we want to do it for a total of 3 to 5 times. In that case, as you saw, I did it for 3 times. The final technique that I'm going to be performing is a Mobs with movement for the AC joint to increase shoulder flexion. So to perform this technique, what we're going to do is get our patient seated. And what I'm going to do is I'm going to come behind the patient and locate the lateral aspect of the clavicle. So I'll start here, come along here until I locate the lateral aspect of the clavicle. And what I'm going to be trying to do here is induce a caudal glide, so a glide of the lateral aspect of the clavicle downwards to help improve that mobilization of the AC joint as he goes up into shoulder flexion. So I'm going to get my kind of hypothenar eminence on the edge of the clavicle, and I'm just going to put my hand over top to help give myself more leverage in this position. And what I'm going to get him to do is go up into that flexion position where he feels a barrier. So let's just go here. Let's say the barrier is here. So now what I'm going to do is we're not going to actually do it yet, but as I push, I'm going to go into kind of an ulnar deviation and hold that as he goes through the range of motion. Once he reaches the full range of motion, I'm going to come off and we're going to release. Okay, so we're actually going to do a couple right now. Okay, ready? So go ahead. Hold that position. He's going to come off and release. I'm going to go again. So I'm pushing down on a caudal glide of the edge of the clavicle and come down. Do a couple more. Again. And we'll do one more to make it 6. And good. And relax. So underneath my hand, typically I'm going to feel in this situation like the AC joint is going to be very stiff, and that's why I'm trying to mobilize it, mobilize the clavicle in that direction to help improve that flexion from the joint. And for the parameters, you can do it for 3 sets, 6 reps. So I just did 1 set of 6 reps there, but in total you can do about 3 sets. And that's the 4 techniques.